started.
All right. I think we've got some people rolling in still here. Give it a second. All right. Well, I hope everyone can hear me. Welcome to the fourth and final webinar for the spring series. We're sorry we can't do it in person, but as we all know, COVID has made life a bit of a challenge recently. But hopefully next year we'll all be able to be in person and see everyone's beautiful faces. I'm Dr. Stowell. I have been with Elkhorn since June and I'm very happy to be here. I graduated from the Royal Veterinary College in 2018 and then did a rotating internship at the University of Illinois in equine internal medicine and surgery, and then did another sports med specialization internship out on the East Coast with the Olympic team vets the year after that. And then I came here. So I will be talking about the pre-purchase examination today. Now, a bit of housekeeping. So if you all, I'm sure you're more well versed in this than I am, but at the bottom of your screen, there's the raise hand Q&A and a couple other things. So we're going to try to keep the webinar rolling as we go through. But if you have any questions that you want to type in the Q&A, you can do that and then we'll answer them at the end. You can do it anonymously or, put your name there if you'd like. And then we will also do some polling questions throughout as well. So now I am going to share my screen and we will get started. All right. So the pre-purchase examination by me. So let's do this first polling question here. All right, so what is the cheapest part of owning a horse? The veterinary bills, the farrier bills, board, or the initial price of the horse? And everybody can take their gander. Okay, I'm gonna end that. It looks like most everybody's got their answer in. And then you can all see that everybody has accurately guessed that the initial price of the horse is the most expensive part. So, the vet bills and farrier bills, as you're all aware, are very expensive as well, but the initial price is often the most expensive. So this is why we do pre-purchase examinations. One, because horses are expensive and we want to make sure that they're healthy and sound when we buy them. Sometimes if you're, big into the competition world or maybe the race world or breeding, you want to make sure that you have a healthy, sound horse for that. Another reason people opt to do pre-purchase examinations is if they've had a prior medical or lameness issue that they've dealt with and they just don't want to deal with that again. And then also sight unseen purchases. So let's say you're buying a horse in another country and you want to do a pre-purchase exam because you can't actually see the horse. I've had clients say a horse was recommended to them by a friend and they want it pre-purchased, but they've never seen it. People buying horses off auctions, a lot of different things. So the important thing to remember with a pre-purchase exam, however, is that it is only a snapshot of what is seen on the day. So while we try to do our best to give you the full picture, full clinical picture of what this horse looks like, it is just a snapshot. And as we all know, horses are very accident prone, and the next day they might put their leg through a fence. We hope that doesn't happen, but it's possible. So when we are doing a pre-purchase exam, we're going to launch the next polling question here. The veterinarian is conducting the exam, or the veterinarian who is conducting the exam is working for whom? So that's the buyer, the seller, or the horse. All righty. Looks like we've got all the people in there, so I'm gonna end it again. And so I liked the person that put the horse because I feel that's very important. And yes, we are advocating horse health all the time. But as the pre-purchase exam, we're working for the buyer. So we want to make sure that we're doing a good job for you so you don't buy a horse that's, particularly got some glaring issues. All right. So moving forward, the components of a pre-purchase exam are going to include the medical and surgical history, potentially any blood work, clinical evaluation, the lameness evaluation, and then any diagnostic imaging. And we're going to delve deeper into those here now. So for history, the one of the first things I always ask is about routine vaccinations, deworming. In Wisconsin, you have to have a current Coggins test in order to sell a horse. So that's very important to note. Same in Illinois. What farrier work the horse has done, if they have special shoes, if they're barefoot all year round, maybe barefoot only in the winter. Any things of that nature. Also, if they have any breeding history, so if it was potentially a standing stallion or a breeding mare prior, or if they are castrated, if they were potentially a crypt orchid and they had to have a more intensive surgery, things like that. Um, and the date they were castrated. So if they're castrated late, they might potentially have more stallion-like behaviors. The other things we ask is any previous illnesses, such as respiratory problems like equine asthma, pneumonia, if they potentially have an endocrine disorder like Cushing's, which is PPID, a metabolic condition such as equine metabolic syndrome, which is the equivalent of human diabetes, basically. They have any prior lamenesses. So if they've ever had to have joint injections done and at what age they started doing it, any issues of laminitis in the past, and if there's any diagnostic imaging that the previous owner has that they're willing to share, because it's very useful for us to compare radiographs at the time of the pre-purchase examination to look for any interval change. So that could be, let's say we take the radiographs on the day of the pre-purchase examination and there's something that looks a little sketchy, but we compare it to old films and it's still there and it's been 5 years and it hasn't caused the horse a problem, then it's probably not going to be a problem. Or if my apologies, if there is, not something, or if there was something there previously and the horse is now lame, but it wasn't lame then it tells us the old films that wasn't the actual issue, if that makes sense. Also, we ask about surgical history, if they've ever had a history of colic, because sometimes those form adhesions and they're likely to colic again. If they've ever had any upper airway surgery, such as a tie back for a roar, an arthroscopy, which is when they inject scopes into the joint, if they've ever had to have chips removed or potentially flushed for a septic joint, neurectomy, which is where they cut nerves to dull pain, which is more common in big time jumpers and things like that. Desmotomies and fasciotomies for tendon and ligament issues as well. So we ask all those good questions and get a full history of what's going on. The next thing we might do is blood work. So there's the option for a drug screen to see if the horse has any drugs on board, such as, Bute, Equiox, or some more intense ones if they have any sedatives on board, things like that. So that's an option we provide. Also routine CBC and chemistry. So CBC is complete blood count. So those two are looking at the immune function of the horse, the health of their kidneys and liver, muscle enzymes, all that good stuff. And then sometimes people opt to get a new Coggins at the pre-purchase as well. So the clinical evaluation is where we're going to be looking at all of the physical components of the horse and do a thorough look around at all the different body systems. So cardiovascular, looking for any murmurs or arrhythmias, and then respiratory, if there's any abnormalities on thoracic auscultation, if they have potentially labored breathing at rest or the inability to appropriately regulate their respiration after exercise. So that would be if we put them through the lameness exam and they're having a really hard time catching their breath afterwards, it might be a sign that something's not right in the respiratory system. Also gastrointestinal, making sure they've got normal good gut sounds all around. Again, looking for surgical scars such as a colic scar or underneath the abdomen. Looking at their eyes, making sure there's no signs of equine recurrent uveitis or potentially really bad cataracts or retinopathies. And a retinopathy is looking at the back of the eye in the fundus where the retina is and making sure that that optic nerve is very healthy as well. Also looking at the urogenital system, potentially if they have any abnormal discharge, that could be suggestive of stones, things like that. if they have a Caslix surgery. So, sometimes that's mostly for breeding purposes, but it can be if the mare has an abnormal vaginal shelf and there might be fecal material that falls into the vagina. They might have a Caslix for that. Also looking at their skin, making sure there's not any horrendous melanomas on those gray horses or things like squamous cell carcinoma, sarcoids, any more sinister types of tumors. Also making sure they're able to sweat appropriately. That's a little bit difficult in the winter time when it's freezing here and below zero in Wisconsin, but in the summer, making sure they're able to sweat properly. So when we do exercise them, they don't overheat. And then we come to the favorite part of mine, which is the lameness examination. So what I do is see the horse go on a straight line and on the circle in both directions. And I like to do it on multiple surfaces because hard versus soft can tell you a lot of different things. And then I run through a series of flexion tests, flexing the upper limb, the lower limb, some flexions that extend the leg behind them. For example, dressage horses often have problems with the psoas muscle in their hindquarters. And if you stretch the leg behind them and they are really reactive when you trot them off after that extension, it may be indicative of some sort of pain there. And those flexions all kind of pinpoint different areas of pathology. So if something flexes more positive, then it gives me a target to go off of and direct imaging from there if the buyer still wants to pursue the horse further. I also think it's very important to do a ridden examination or weighted surcingle if possible, especially, if they haven't ridden the horse before. This lameness evaluation is supposed to prepare the horse or show the horse for its intended job. So if you're just wanting a kid's pony to peck your child around and be a really safe animal, then you may not need to do as intensive of a workout and see how they respond. But if you're wanting a Grand Prix jumper, well then the lameness evaluation's got to be pretty spot clean for them to pass. So based on their job is kind of how we go about this. I also, it's very important if you can to do all the things you intend to do with the horse before the pre-purchase exam. So if you want it to be an eventer, make sure you're doing all the tests, such as putting the horse through water and jumping over logs and making sure they're not spooky, all those good things. And if you want it for a dressage prospect, make sure it can do canter pirouettes, leg yields, all that good stuff. I wouldn't advise buying a barrel horse for something like that, although they can switch jobs. That's perfectly acceptable too. But this is kind of why we do the examination, to see if they're going to be suitable for that job. So after we do the whole lameness evaluation, I'll also listen to the heart and lungs again, make sure, like I said before, that they're able to appropriately elevate their heart and respiration rate, and then also reduce them. And another point with the weighted surcingle, which I forgot to mention, is that applying a weighted surcingle on the horse's back just in a lunging situation is a really good test for back pain. Riders can often manipulate their weight and help the horse, and they're able to hide back pain more. When you have a weighted surcingle with dead weight, the horse is much more likely to show you if there's true pain, which is a good little trick I learned on the East Coast. So going forward to diagnostic imaging, some people opt to do this, some people don't, kind of depends on the price point. We do offer a package of radiographs that's a reduced price if you opt to do more views. What I generally recommend, if I am able and can do the whole shebang, would be to take pictures of the front feet, the front fetlocks, the carpus, so the knees, hind fetlocks, and hocks. And then stifle, back, and neck are kind of auxiliary images. If we're able to take them, that'd be great. Or if we notice an area that's particularly responsive during flexions or palpation, then I'll say we should probably look at this, make sure there's not a problem. Some people opt to perform ultrasonography as well if the seller has informed them of an old injury potentially to a tendon or ligament, and they want us to take a look at it, make sure it's healed well. So that's an option as well. For some of the, bigger clients that want to make sure this horse has the competition ability in its future, they might do things like scope the horse, make sure their upper airways functioning properly. If it's a big time, eventer that they want to go to Rolex, or sorry, Land Rover now, and make sure their arytenoids in their throat are adducting so they can get a lot of oxygen down there. I've had people perform bone scans on pre-purchase examinations before. And even MRIs to make sure that their feet are fine. We can't do whole body MRIs in horses quite yet, but that's something that maybe in the next couple of decades we could, and that'd be great because it'd show us a lot more information than what we already are able to do. And that's all the diagnostic imaging that we often do. And then it comes time after we've done all the things and, taken a very thorough look at the horse for the decision making. And I'm going to launch this third poll here. If I can get it. There we go. All right. So true or false, in order to buy a horse, it must pass the pre-purchase examination. Got almost everybody in there. Give you a few more seconds. All righty. And we're going to stop that. And everybody was correct. So you do not have to necessarily pass the pre-purchase examination in order to buy a horse. I equate pre-purchase examinations to dating. No person is perfect and no horse is perfect. It's all about what you're willing to deal with. And every horse is going to have a fault. It's just if its faults are something you're willing to take on. So let's say the horse has some mild coffin joint arthritis in its front feet, but it's a little bit older, and with maintenance that we can keep them, happy and healthy and moving with some joint injections every now and then, or potentially some supplementation, put them on Equiox, all these things. And the horse has a stellar personality. You're probably going to go with, well, this horse is a really nice animal. I've already fallen in love with him. The coffin joint arthritis isn't that much of a problem for me. The other option could be that, the horse has some potentially back pain, and you have had a problem with the horse in the past that bucked a lot because of back pain, and you just don't want to go down that road. That's perfectly fine. Then the horse doesn't pass for you. So just because it doesn't necessarily pass doesn't mean that you still can't buy it. So that's where that comes from. It's all about, as the next thing says, weighing the pros and cons, what's good about the horse, what's bad. And we try to go through that in the pre-purchase examination with you guys and give you, all of the information we have. We're not there to necessarily tell you this horse is amazing or this horse is horrible. We're giving you a full clinical picture. So there's going to be a lot of good and potentially a lot of bad, but hopefully not a lot of bad. The good thing, though, if we do find some things, is that you can potentially negotiate the price based on these findings. So I've had clients that we found some things on the pre-purchase examination, but they still really like the horse, and they use that to kind of sway the price a little bit lower. So that's possible as well. And the other thing I really encourage people to do after you've made all these decisions is make sure you have a buyer's contract and everybody signs it so that all the legalities of it are covered. The other interesting tidbit that I found is that there's a reason the term is called vetting, and it's not just because of, equine medicine. So it exists for performing things like background checks in people. But the fun part is that it comes from the 14th century Norwegian term, which means if you would investigate a person if a visitor comes to your house, and they were called a vet. So that's a VETTE, which is a supernatural or a troll. So that you would be vetting them just to make sure they're not a troll, which I thought was very interesting. So that is the gist of pre-purchase examinations. And now let's see if we can open it up to some Q&A. And I don't think there's any questions. So if anybody has any questions, we're more than happy to answer them now. Or if you think of them later, you can always call in and we'd be happy to answer them as well. But I thank you. If there is no questions, I thank you for your time, and hope this was a little bit helpful. And we will hopefully help you guys get some good horses in the future. And with that, I think, oh, I see it. Hold on, let me stop. And with that, I think, oh, I see it. Do you have sample? Oh, so the question is, do you have sample buyer contracts? Not with me at present, but I have some that we can put out there of clients that I've had before. They've typed up something, and essentially it says, I blank agree to buy this horse for this price on this day. Or if there's any pending conditions, if you want to say, I agree to buy this horse with a trial period of 2 weeks or something like that. So you can modify it to however you want. Any other questions? Any other questions? No? Alrighty then. Well, thank you everybody. This was really great, and I hope that next year we will all be able to do it in person. Alrighty then. Well, thank you everybody. This was really great, and I hope that next year we will